Hi, everyone. This is Laurie Yitkin. I'm a certified divorce financial analyst practicing throughout California, and I'm really happy to introduce you all today to Angie Gange, who is a Medicare advisor. And the reason why I invited Angie to join us is that I work on so many divorce cases, gray divorce, and so I have men and women in their late 50s, early 60s, mid 60s, and we're trying to figure out how to budget for healthcare costs going forward. They may be on their spouses or their own healthcare insurance. They may be self-employed and on Covered California. And so trying to figure out what monthly insurance premiums are going to be, plus additional expenses, is a really intense effort. And so I'm really glad that Angie has agreed to spend a few minutes with us today. So welcome, Angie.
Thank you. Thank you for having me on. This is great. I appreciate it.
So why don't you, for people that just haven't even waved into or waded into Medicare, what is just a basic summary of Medicare? We've all heard about all these various parts of Medicare.
Well, Medicare is great. So to get it started off, I always say that, when you turn 65, it's like you get a raise. So it really, it is. There's a lot of people that get very excited. So it's a really nice birthday present when you turn 65.
Right.
Medicare starts to sound like alphabet soup, and anybody that's tried to navigate it describes it as such. But I'll try to just make it, and this is usually what I'll tell people. I'll say, do you have just a couple of minutes and I'll explain to you what ABCD is, and I'll try to do that in a few seconds here.
Right.
But A, B, C, and D are really the elements of Medicare. A and B are what they call original Medicare. A is everything inside of the hospital. B is everything outside of the hospital. So in layman's terms, from if you're going to go to the hospital for a hospital visit or if you're going to just go to the doctor or physical therapy, that was the difference between A and B.
Right.
Technically, A is free and B is right now $185 a month. Right now it's September 9th of 2025. That may change. It does usually each year, but it's a pretty affordable way to get some health insurance.
Absolutely.
The challenge of that is that that only pays 80%. Lots of times people will call that original Medicare. So then you have to take a look at C and then D.
Okay.
C is, I'll talk about D, but essentially D is prescription drugs. That's an easy way to remember it. It's your drugs. Sometimes you can either go, the C includes the D, or you need to have them separate. And the difference between C, to be honest with you, I like to say it's like vanilla and chocolate. There's kind of two paths you can go. You can either have an Advantage plan. So your clients, Lori, that have Kaiser, that's the plan that they would go.
You mean like an HMO type plan?
Correct. It's an HMO. So in San Diego, for example, where we're recording this, Sharp is the most popular of those HMO Advantage plans. There's a lot of benefits to those. The biggest one being that there's zero premium for the most part. There's also some bells and whistles, but a lot of those are going to be going away over the next few years. For example, we used to have, things like a card for CBS, for like a quarterly card or silver sneakers, things like that. So we are going to start to see, in order to keep the medical coverage as strong as possible with some of the funding cuts, you're going to see a little bit of those kind of, like I said, bells and whistles that may not be as readily available as they have been in the past.
And you mentioned $0 for premium. Did you mean for the premium or something else?
So it's usually a $0 premium, so a monthly premium.
Wow.
So,
okay, because I mean, I'm like zero. What? Is that a error? Well, okay, that's good.
No, it's fantastic. So, for a lot of people that are, especially if they're on a budget and they're happy with being able, the downside of it is you're going to have a primary care and you're going to be part of a medical group and part associated with the hospital. So you don't have as many choices. So for a lot of people, they're comfortable with that. That's fine. They don't travel that much. They like their primary care doctor. They're happy with keeping their monthly expenses down. And so that's really nice. The other option is what we call supplemental insurance. And that is, like I said, there's vanilla, let's say we call it Advantage, and supplemental would be your chocolate ice cream. And the nice part about this is that you can go to any doctor anywhere. You completely have choices. And typically the fees are anywhere between about $100 a month to, at the very most, $300 a month. So it still is pretty affordable. And though that plan C, that section pays for the other 20%. So lots of times you'll hear people talk about Medigap. That's really the gap, right? Between what original Medicare, A and B, pays for. C would be your Medigap. depending upon how old you are and your zip code. So for somebody will determine the premiums. So for somebody that, for example, is turning 65, the premiums are going to probably be less than somebody who's in their 80s and 90s.
And that's for C or D or both?
That's for C. Yeah,
Okay,
thank you. That's for C.
okay.
D is kind of a whole nother game. D actually, and we can talk about that later, but essentially to answer your questions quickly, that really depends on the medications, that people are taking. And there's lots of different options and some are better than others.
Okay, because the D is the prescriptions and the C, you have the two options in C. Okay, you have the
You got
vanilla and the chocolate within C. Got it.
There
And
you go. You
vanilla
got it.
has no monthly premium, but the chocolate does have a monthly premium.
Correct. But
Okay.
even still, it's not that much. And you and I have talked about that, as far as, if you're single and you're, for example, if you're getting out of marriage or, you're starting your own business and you have to buy medical insurance, it's really expensive.
I mean, because I work with men and women throughout the state, and I have some women telling me it's $1,500, $1,800 a month for just health insurance when they're in their early 60s, and I'm shocked.
Absolutely. In fact, I just spoke with a client this morning. She's just turned 65. We're helping her set up her Medicare insurance. And she did say that. She said, I'm spending $1,500 a month on my medical insurance, and she's healthy. But
Wow.
so she's thrilled. I said, well, she's decided that she wants to go with a supplement route. It's probably going to be, about $400 a month for her. So again, it's a huge, raise. I'm like, happy birthday. It's fun to turn 65.
And that's what I was, my second question to you was going to be, for all these people that are spending well over $1,000 a month on their healthcare insurance, can they expect a price decrease when they
Yes.
get on Medicare? And you're saying even with the different parts, it probably will be a nice savings.
It 99% of the time it is. You're going to have, we talked a little bit about IRMA. So there is an option. So, if you make a little bit more money, that 185 could go up a little bit.
Mhm.
And I wrote this down. So as of now, again, I'll say September 9th of 2025, because it could change. If a single person is making over $106,000, there's a little bit of a premium that they might put on there. If it's a married couple filing jointly, it's 212,000.
And what Angie's referring to is the IRMA, which I think stands for, oh gosh, I would forget, IRMAA.
Correct. And we like to joke, this isn't like your sweet neighbor, Irma, that lives down the street. Irma's not a great thing. But this is important too, Lori, for your clients, as you're doing financial planning, is that they do take a 2-year look back on it's your modified adjusted gross income. So think of MAGI. That's how I always remember it. And so take a look at that. And there's some strategies that you can put into place and some financial investment planning to make sure that people are more prepared for that when you're turning 65.
Yeah, and that's if you would look at your tax return, you may see different things of gross income, adjusted gross income, taxable income. And as Angie has said here, there are different things that are included in your modified adjustable gross income, things that are not. And so there is a little bit of playing around in education and planning. Now, the 2-year look back, that scares me. What does that really mean? Like, are you actually sending your tax returns to the Department of Medicare? I mean, or what's happening?
They'll see it. You don't have to send it there because that's actually through. So that's a really good question. And that's why I really like working with you, people like you, where you can take a look at, even in your early 60s and plan for that. They will look at it. And this is a really good question, that 185, that original Medicare, that will, if you're taking Social Security, it'll automatically come out of your Social Security. If you're
That's
not,
why I've seen people do that. Okay,
yeah.
and that was the part B, is that correct?
Correct.
The
That
B.
is.
And I've seen some people get a deduction for the Medicare, and you're saying it's typically automatic. It'll
It'll
come
be
out.
automatic.
Okay, got
So
it.
they'll automatically look. If you aren't, and you don't have to, you don't have to start taking Social Security to start taking Medicare. That's really important too. So I just had a story so there was a woman that she got bad advice and she didn't want to take her Social Security, and they told her that she didn't have to, that she couldn't take Medicare at 65,
Oh my.
which you and I both know isn't true. So when she decided finally to retire and start taking Social Security at age 70, there is a penalty. And so that's what's the other part that's important to know, that if you don't take Medicare at 65 and you don't work for a company that has 19 or more employees in it, you will be penalized. So there's a lot of people that, for example, they'll come to me and they'll say, hey, I'm not really ready to take Social Security. Do I have to take Medicare? And I'll say, well, what company do you work for? And lots of times they'll say, oh, I work for Sharp Hospital or I work for Qualcomm. And I'll say, nope, you're good. You're fine. Stay on that employee group healthcare
Uh-huh.
now. And then when they do decide to retire, there's a form that they will be able to get from their HR department when they apply for Medicare that will prove that they've had medical coverage.
Oh, no wonder. Sure. And that makes sense because I do see a lot of folks that don't retire at 65. They continue working and they say, I just want to keep my employer, because sometimes the
Yes,
employer subsidizes it, typically. So maybe it's,
they
yeah.
do. Also, if people do have a spouse or if they have children under 26, it
Mhm.
just makes more sense for them to stay on their employee group healthcare until that time comes. So
Sure.
I like to work with the
Oh,
clients, refer them to financial planners because there are a lot of variables to think about it as far as just being smart in your financial planning and budgeting.
so many issues to think about it. So let's talk a little bit about your role as a Medicare advisor. How do you help clients save money while navigating this? Which I mean, this is going to be a confusing process. I can tell you, thank goodness you know what you're doing and you
I
have the
got
expertise. And this is
you.
what you do day in, day out, because we need
Yeah.
people like you to tell us. So how can you help people save money when they are embarking on this Medicare adventure?
So thanks for asking. The best part of my job is I'm free to the client, and I love that. So essentially, we work as an independent broker for all of the major insurance carriers, whether it's United Healthcare or Cigna or Humana or Aetna or a plethora of other carriers that are there. And the best way to describe how we're compensated is the insurance companies pay us as an independent broker a little bit in order to alleviate their 800 numbers, which is a win-win for the carrier, as well as the client. So instead of the client feeling like they have to call the carrier and wait on hold for 30 minutes or try to navigate
Or
the system
more?
more, exactly, they can go through me, or another independent broker. And I'll say I'm almost like a concierge for you and that middleman to be able to help, be able to first off with the customer service, but secondly, the difference with Medicare that also sometimes is really confusing for people that are new. In fact, it was confusing to me, is that it's Medicare is Medicare. So if you're going to look at, some of these supplemental plans, there's a little bit of variance in the advantage plans, depending upon the medical group. But for the supplement plan, we have two options. One is a plan G, one is a plan N. Those are really the ones that we're recommending right now. The only difference with that is that G has a zero copay and doesn't. The annual deductible is $257 a year.
That's
That's it.
it, $257 a year. Do you know what my deductible is right now?
Right. And that's why people say, oh my gosh, this is so great. It's your great coverage. And with the supplement plans, what's so nice about that is you can go to any doctor anywhere. So you can go to your San Diego doctor that you like, but let's just say they want you to see somebody at Stanford or at the Mayo Clinic or at Cedars-Sinai or at Hoag. You can go to any doctor anywhere. And
Does
that's
that
what's great about
include
that.
mental health?
It does.
Oh, wow.
Yeah,
Okay.
absolutely. So I think we like 99% of all mental health professionals are covered by Medicare. So
Wonderful. You
yeah,
still want to check, of course, and then you could probably help the client know
absolutely.
which professional. So what, because you talked about this 2-year look back and such, what's a good age for people to contact you, to reach out, to plan for this?
So I would recommend for your clients when you're working with them as far as their financial planning, I would tell you to bring up the conversation when they're 61, 62, so
Okay.
that they can plan for that. When they're working with choosing a Medicare plan, somebody like me at 64, that's the perfect age. We can set them up. You can be able to sign up for Medicare 3 months before your birthday month, and then that month and 3 months after. So we have some time. It does take a little while to get that, the MBI number, your Medicare number.
Mhm.
So it takes, in the past, I've been able to get it in about 48 hours, but it's nice if we have about a month, to really kind of go through it. And then to be able to have the opportunity after, this discussion, I'm sitting down with a woman who turned 65 earlier in the month, and we're going to go ahead and get her Medicare's, or I'm sorry, she turned 65 in October. So she has her Medicare number. It's effective October 1st. We're going to go ahead and sit down, show her all of the plan options, and pick the one that is the best for her and, quite frankly, has the lowest premium. And we set that up. It's a simple form. She'll get a card in the mail and it'll start on October 1st for her.
Wonderful. Well,
Yeah.
it is really important from my perspective working with folks who are divorcing, because especially the folks that are going to be relying on spousal support, they have to have some range estimate of what healthcare costs are going to be. And that's
Absolutely.
why you are such a good resource. I mean, talking about like comparing to the prescription drug copays they have today, or the deductibles we talked about, the out-of-pocket maximums. I know you can't really do an exact number because things change, but at least to give folks a range to know what money they're going to need, particularly if they are requesting spousal support. I mean, that's where I come in. Now,
Absolutely.
tell me your geographic reach. What clients from where can you work with?
So really, I can work with clients in any state in the country. So I typically work with most people that are, local, just because it starts the referrals. But
Right.
I have all over the country, and that's important because it's a little bit different in every zip code. And when we can really give quotes to people. Lori, the PPO plans are going to all be changed this year. And what's so nice about what I can do is even just simply with a mailing address, an email, and a date of birth, we can give somebody a quote. And
Wow.
I've become more and more passionate about helping people with this because it's confusing, it's complicated, it's overwhelming. It's expensive, but there's so many ways that we can be able to help people. And so, for you, then they have more money for investments, or they have more money for their kid, for grandkids, Christmas gifts and, birthday presents and, cruises and, giving back. I will say something. I helped somebody save, actually a gentleman and his wife was very ill, and it was one of my dad's buddies, and he asked if I could help him. And I ended up sitting down and I was able to save them $11,000 this year on her prescription medication plan.
Wow.
And I looked at him and I said, that is, I said, I don't care what you do with the money, but give it to the insurance company, give it away, whatever you want to do with it. And he was just thrilled. So there's sometimes people I can save, $20, $30 a month, which is also wonderful. Go out to lunch, take your, friend out to lunch and, instead of putting it there. So, and honestly, the forms are very simple. So it's a really easy process.
Yes, I just want people to know that, you may pay a different amount than your neighbor, your cousin, or whatever, because it will be somewhat income-based, as
Yes.
Angie's talked about, this whole IRMA surcharge. But this has just been such valuable information, Angie, and I'm sure you're going to be getting a lot of calls. So
Happy to help any of your clients.
And remember, Angie's no fee because she gets paid by, the vendor that you ultimately end up being, and she's independent. So she really, she can recommend a variety of choices and is not an exclusive agent to one company, which really makes, I think that provides the best advice possible.
And that's really important also. So if somebody goes straight to, I just had the example today, if you go straight to, for example, Blue Shield,
Mhm.
or if you go through me, it's to the penny, the exact same price. So it just makes sense to be able to use somebody like an independent broker like myself to be able to help you navigate it so that you have all the choices.
So the way to contact Angie is through the website, which is centerpieceinsurancegroup.com. That is centerpieceinsurancegroup.com. And don't worry, I'll include the link below the video. So thank you so much, Angie, for spending your time to join me today.
Thank you.